And we continue to learn more about the ongoing effects of COVID-19 long after the person is initially sick. Sometimes the conditions are odd, like memory issues or confusion, even behavioral changes.
But others are potentially deadly, like strokes or an enlargement of the heart. News 8 Now's Mel Meyer, explains what health officials are concerned about as the pandemic continues.
It started in the spring. Early reports of a link between COVID-19 and possible Kawasaki disease in children.
What we've asked for is for the global network of clinicians to be on alert for this.
Experts with the World Health Organization warned then there could be other effects of the disease that were not yet known.
We've seen this in the past with many emerging diseases. They don't necessarily only attack one type of tissue.
We now know that's the case with the coronavirus. Experts have found about 80% of patients who are hospitalized have some sort of residual scarring of the lungs, according to Dr. Joseph Potaruca with Mayo-Clinic-Health-System.
Even some patients that were minimally symptomatic or not requiring any oxygen, just some observation, they're seeing evidence of some inflammation, and now after the inflammation, scar.
This impacts lung function and capacity that patients will not get back, which can be worse for people with some pre-existing conditions.
A little bit of a burden on top of a chronic process can potentiate their organ decline.
Patients have also reported strokes.
They're getting blood clots in the legs, which can of course travel to the heart and give you that big blood clot in the lungs, which could be life-threatening.
For some patients on chronic pain medications who may be more susceptible to flare-ups, they're seeing more arthritis and muscle pain.
We don't entirely understand what the connection is, what the pathophysiology is, but it's very interesting and very bizarre.
Dr. Potaruca says this is not to alarm people because these after effects are not very common. But it does show we just don't know everything about this virus and its full impact.
The numbers go up as people get exposed, as we get higher detection levels with testing. We're going to see a lot more interesting findings, I predict, in the time ahead.
In La-Crosse, Mel Meyer, News 8 Now.
The doctor says most patients will not get these subtle effects, but can still spread the disease to those who are more high risk. They might not fare as well from the initial symptoms or long-term symptoms.